All right, doctors. Well, welcome. Let's go ahead and get started. I've committed to try to keep this at or under an hour. So let's go ahead and get started. I'm really grateful that you're here and grateful to spend a little bit of time with you discussing some my passion, which is orthodontics. So let me just give you a little brief introduction on myself. My name is Harrell. And I am the head instructor here at Progressive Orthodontic Seminars, a position that I've just taken recently. And this is my family. That's my number one priority. My wife, Anne Marie, we've been married 28 years this year. And the boys in the picture are mine. We have 4 boys. And I claim the other 2 girls now because they're married into the family. So I finally got daughters that I've been waiting a long time for. And no grandkids yet, but maybe soon. So I practice in San Clemente, California, almost 20 years there with the best dental team in the world. Couldn't ask for a better group of ladies to work with. Back in late 2017, I ended up with a surprise, though, and found out that as I was having some dexterity problems, some coordination problems with my hands, I discovered that I had some pretty severe cervical spinal stenosis with a bone spur growing specifically onto my spinal cord that had caused some cord damage. And so given the damage and the loss of the dexterity in my hands and the damage to the levels above and below where they had to do surgery, it was recommended that I retire from clinical dentistry if possible and sell my practice, which I made the difficult decision to do. And fortunately, 10 years previously, I had trained with Progressive Orthodontic Seminars and had done a lot of orthodontics in my general practice. And so, with some disability insurance in tow, was able to start a new career with Progressive Orthodontic Seminars as a consultant, as a teacher, as a mentor, instructor, and it's been fun. It's been an awesome journey, and I'm very excited about it. So I'm grateful that you guys are here. That's a little bit about me. What I'm excited to talk to you about today is the benefits of offering orthodontic services in your practice. And so I'm assuming that those of you that are here are new to the idea of offering orthodontics in your practice, or maybe you have done a little bit. Maybe you've dabbled in aligners, which is what I had done prior to realizing that I needed some real orthodontic education, and found Progressive Orthodontic Seminars. So let's just talk a little bit about some of the benefits that come to us, our team, our patients, when we do ortho in our practice as a general dentist. For me, the first one would just be the fact that doing orthodontics is fun. I call it the joy of orthodontics. You're changing lives, and I know that for most of us, one of the real joys of doing dentistry is when we're able to take an adult who hides their smile, who doesn't feel self-confident, and we're able to do cosmetic work on them and give them a beautiful smile. And when we see them and we see them open up and we see the joy in their face, we see them not hiding behind a hand when they smile, it's not just their teeth that changes, but they change as a person. The way that they present themselves changes. And that's really fun. And I enjoy doing that on adults. I enjoy cosmetic work. But, for kids, for children, teenagers, there wasn't really anything to offer them in my practice that brought that same level of fulfillment for me and my team, unless, one of the kids fell down and broke a tooth or something like that. But doing orthodontics brought that same fulfillment and joy of changing somebody's life, of taking, a child who's in elementary school or in middle school who feels shame and hides and feels closed behind lips or a hand just because they feel embarrassed about their teeth, and maybe they're getting teased about it. And when all of a sudden you're changing their teeth, you're changing their life, and they come into your practice, months after you've started treatment, all of a sudden it's like somebody opened them up and they're happy and they're smiling and they present themselves differently. And so it's like doing cosmetic work on these younger people, which I just love the opportunity of doing. So, to me, that it just brings good energy into my practice. So I wrote here, maximize the energy in your practice. I feel like doing orthodontics makes every day fun. It breaks up the routine of the things that I'm doing. Sometimes it's not fun to sit down and grind out a whole mouth of cavities and fillings. But doing orthodontics just is a nice energy lift to your practice for both you and your team. It's fun for everybody. And I feel like it makes me a better, well, I know it makes me a better doctor, a better practitioner. It gives me a different lens to look through to understand what I'm seeing when I look in my patient's mouth. Even if I'm not going to do orthodontics on that patient, I make different treatment decisions and I understand better what I'm seeing and what's going on with my patient, because the mouth is very dynamic. The position of the teeth is determined by function. It's determined by the muscles that surround the teeth and by the bone that surround the teeth. And the teeth have found this balance where they're positioned. And so as I understand what forces are at play to put those teeth there, I can make better treatment choices and better treatment decisions for my patients. Definitely doing orthodontics increases revenues, which we'll talk about a little bit more as we move forward here. I started doing orthodontics in 2007. My training was in 2007 because we were starting to go into a recession. And I had heard that orthodontics was one way to kind of recession-proof your practice. And as I found, in Southern California, we do a lot of cosmetic work. And as I found that cosmetic work starting to dry up, as people didn't have the resources in that recession, I started looking at things that I could keep in my practice and not refer out, looking at doing more root canal endodontic training, more perio surgery or perio training, maybe more extractions. And I realized that what I send out the most is orthodontic referrals. And so if I could keep some of that orthodontics in my practice, I'd be able to really not only increase my revenue, but kind of help recession-proof my practice, because every parent plans on spending money on their child's orthodontics. It's almost a fund that they have set aside. And so even though they might not be spending money on themselves for cosmetic work or things that aren't necessary, they will spend money on their children's ortho. And so it does help you by providing those services and not referring them out. It does help you to get through recession. And it also kind of levels out your income. So instead of having a month with high collections and a month with low collections, when you have a lot of orthodontic cases going, those patients are usually paying on a monthly basis. And so having that monthly revenue can sometimes level out your highs and lows that we tend to get in dentistry from one month to the next. It definitely brings in more referrals, not only from your adults that you're treating, but it's pretty cool when you have a 12-year-old who's referred a whole family to you, because they're out talking about their experience. They're talking to their friends, they're talking to their friends' parents. And when you get a whole new family in your practice and they found out about you through, little Susie who's 10 or 11 because she was talking to her friend about her braces or about her aligners. And that's pretty exciting. How often do you have young kids going out and referring people to you? But also I got more referrals from specialists, not necessarily the orthodontist, but definitely more referrals from specialists, the endodontist in town, the periodontist in town, the oral surgeon in town. When they see that my understanding of the mouth and my expertise level is increasing, and that they see that, in my practice, I manage bigger, more difficult cases because I understand more than just broken teeth and fillings. I understand how a mouth needs to be built in order to function properly. And so when you get a patient that comes to you knowing that they have a lot of dental work that needs to be done and that it's complex work and it's going to be expensive, but they've been referred to you, like told by their specialist, by their endodontist or their periodontist or their oral surgeon that you're the person that should treat their mouth as their general dentist, they come to you already trusting you, already knowing that it's going to be complex and probably expensive, and you don't have to earn that. They come with that intact, which is really neat. Definitely leads to more aesthetic treatment in the practice. Okay, so one question I ask every one of my patients on a daily basis is, have you ever thought about straightening your teeth? And the minute that I ask that question, which just takes a second to ask, not only are we talking about straightening their teeth and talking about possible ortho treatment, but we're also talking about restorative work, because they bring up other issues like, I don't like the color of this tooth, and I don't like the way my gum does this over here, and I don't like the way that this tooth looks. And so not only are we doing orthodontics as we ask, have you thought about doing ortho have you thought about straightening your teeth? It leads to a lot more treatment, which I'll talk a little more about in a little bit here. It improves your health of your patients, which we'll talk about as well as we go through these slides, but definitely improves the periodontal health of our patients. It improves the function of the temporal mandibular joint, helps us to create proper space and proper setups for implant placement, for restorative work, crowns and bridges. We treat teens, we treat children, we treat adults, we treat mixed dentition. phase 1, phase 2. And in my practice, I enjoy doing a combination of both full bracket cases, including skeletal anchorage, including even surgery cases, and doing aligners as well. And so all of this is available to you as a general dentist. You can do as much as you get an education to be able to do at the level of the specialty, which is what we like to teach you to do at Progressive Orthodontic Seminars. So let's talk more about these things. But a question to keep in mind as we go through this is, how many orthodontic cases are you referring out each month? I realized I was referring out a couple of cases a week. You know, I had a young practice, a lot of young families, so maybe more referrals than the average practice, but I was referring out a lot of orthodontic cases. And then in addition to the ones that you're referring out, how many people come into your practice every day that you don't even recognize the need for orthodontics? It's not even something that's brought up. And so there's even probably more orthodontic cases that need treated than what you're recognizing and referring out. So how much production is being lost or unrealized because you don't have an orthodontic education or orthodontic training? I mentioned how orthodontics brings in additional revenue. So it's not just the money that we earn from the actual orthodontic case, okay? But it's the periodontal service and the caries control that needs to be done before we start an ortho case. If the patient has inflammation, if they have gingivitis, if they have active periodontal disease, if they want to straighten their teeth, we have to get that under control first. So we provide periodontal services, scaling and root planing. We have to provide caries control because we're not going to do orthodontic treatment if there's active caries. So we're going to be doing fillings or maybe temporary crowns until the ortho is completed. So it does bring on work to prepare people to be able to do ortho. And then some of our orthodontic cases require extractions, which is additional revenue. Some of our patients, you know, some of you doctors may be into doing sleep or airway evaluation and treatment in your practice. And so as part of orthodontic treatment, that may lead into a conversation about sleep, airway evaluation, helping to see how they function and how their airway is. And that can be part of your orthodontic treatment. It leads to implants and implant restorations if they're missing any teeth. And it definitely leads to cosmetic work and restorative work, okay? Because whenever somebody gets their teeth straight, there are some patients that have such beautiful teeth that once they're all straight, everything looks amazing. But most patients who've had some wear and tear on their teeth, when they finally get their teeth straight, they might need to replace an old unaesthetic crown that has a poor margin on it or doesn't have the right color. They're going to want to whiten their teeth. They're going to want to do a veneer or do veneers if the shapes or colors of their teeth don't look good. We might do some cosmetic bonding, okay? We're probably going to do some things that is additional income to the practice to help their mouth look amazing. Oftentimes it leads to, you know, doing a full mouth restoration case, but in combination with setting it up first through orthodontic treatment. And even if a patient doesn't want to do full ortho treatment, maybe they just came into you for veneers and they were going to do veneers on their upper front teeth. And you're looking at the lower front teeth going, you know, if I could also maybe give you a deal, but if I could also straighten your lower front teeth and whiten them, then you're going to have beautiful upper and lower teeth rather than just straight white upper teeth with crooked, crowded lower teeth. So it does lead to a lot of additional work outside of just doing the ortho. Gingival grafting. So sometimes after or even before the orthodontics, we do some gingival grafting procedures. So if you do those in your practice, you would have opportunities for that. I like to do gingival recontouring using an electrosurge or a laser following the ortho treatment and really idealizing the gingival architecture for that patient. And so that's another source of income. And after patients have straightened their teeth, they're much better at maintaining their teeth. You know, so I find that those patients who have spent the time and effort to straighten their teeth and get their mouth healthy, they come in more regularly for perio maintenance and for regular checkups and prophies because a healthy mouth has become an important part of their life. We continue to offer retainers over time if they lose their retainers. Sometimes we offer splints because they might be grinding their teeth and we don't want to wear down the nice, you know, restored mouth that we've created. And so retainers and splints is additional revenue. And then sometimes patients move away or they don't wear their retainers, and when they come back in, they want to pay you again to maybe re-straighten some things that have gone crowded, right? And again, we get referrals from patients and specialists that lead to additional work for us. So there's a lot of different avenues and sources for income that stem from doing orthodontics in our practice and having these conversations with patients about ortho and straightening their teeth that I didn't have before I started doing ortho, or at least not in the quantity that I had after starting to do ortho. So when we decide to do orthodontics in our practice, there's an upfront investment, okay? We do need to pay for an education, and fortunately, you can pay for that as you go. And you also have to invest in some tools and some inventory to be able to have what you need in your practice to be able to provide orthodontic services, especially if you're going to do brackets, which I highly recommend. It takes a little bit more of an inventory of tools and things to do brackets than it does to do aligners. But I really think you should do both in your practice, because each different way to treat patients has strengths and weaknesses. There are strengths associated with braces, there's strengths associated with aligners. And so I like offering both to my patients and knowing how to use both. So there is an upfront investment, but we have a fabulous return on our investment. And even if we just look at the income generated from the actual ortho cases and don't look at all of these other revenue streams that come from doing ortho, it's pretty easy to average one patient a week who wants us to take records and start doing an ortho case. And so at one patient a week, which is pretty average for the general dentist who does ortho in their practice, that's only 4 new patient starts per month. That's 52 new patients or cases per year. And with an average orthodontic case fee of $5,000, you're looking at somewhere in the neighborhood of $250,000, $260,000 a year that you're going to increase your revenue just from the ortho treatment. And that's, a very conservative estimate on the number of patients that you might start. I work with some doctors that I do consulting and mentoring for that are starting way more than 52 cases per year. Some of our doctors will have started over 100 cases before they even graduate from our program. So it's actually awesome to be able to learn as you're doing treatment. Okay, it's very difficult to learn everything there is to learn about ortho before you start your first case. It's like me trying to teach you how to sail a sailboat before you ever actually go out in the water. There's value that comes from actually going and trying to do it, and then coming back and learning, and then going and doing it and coming back and learning. It gives you a framework as you start treating patients to actually know what we're talking about when we teach these courses. And any other dental procedure, at least most of them, if you're going to do a crown, you have to know how to do a crown from start to finish when you sit down with a patient, because you're going to start and finish that procedure. But ortho cases are going to take anywhere from 12 to 24 months for most cases. And so initially, all you have to do is know what kinds of cases you're looking for and go and find some willing patients or friends or somebody and get started, because all you need to know is what kind of case am I looking for. And then right at the beginning of the seminars, you learn how to put on braces. And so you go put on braces. And then as the teeth start to get straight, you're learning what to do as you go. And so basically, you can earn while you learn. You can have your patients paying for your initial investment. So, you start a few cases, you start charging a fee, you get a system going in your practice, and they're basically paying for you to go learn how to do ortho. So you can make way more money by the time you're done with these seminars than you paid or invested for what you needed up front, just because you're able to treat cases as you're going through the seminars, which we highly recommend. Orthodontics is a valuable skill that keeps on giving throughout your career, and not just financially, but it's very rewarding. It's very satisfying to be able to help patients in the way that we can with orthodontic services. So learning ortho, these are a lot of happy patients in the practice that you're able to interact with and do something that they're excited about. You'd be surprised how excited kids and adults are just to come in and pick a new set of colored rubber bands to tie their brackets in. So it's exciting. It's fun. It's a great energy that patients who are having orthodontic care bring into the practice. Most of us, though, as general dentists, don't jump into doing ortho because we didn't learn anything about orthodontics in dental school. They taught us how to do everything else. We come out knowing how to do a root canal, how to do some perio, and come out knowing how to extract teeth. And yet we don't really come out knowing how to do anything orthodontically or even really understand what we're looking at and when to give a referral. So let's try and remove the mystery. I'm not going to be able to do that in the next 30 minutes that we have, but I want to just give you a few little insights that will help you to see that it's really not difficult for you as a general dentist to do orthodontics in your practice. And initially, yes, it's starting out with cases that are appropriate for your level of training, but it only takes a few successful cases to start building your confidence, and with the help of mentors and consultants that we have to help you, to be able to confidently go out and talk to people who need more complex treatment and provide more complex care for them. So if you've never really looked into how do we straighten teeth, probably most of you are aware of aligners, and you know that with aligners, we're making a series of different stages between where the teeth are crooked to where they become straight. And we're going to make a different set of aligners for each one of those little minute changes. And as the patient goes through a set of aligners and wears their aligners, they're basically just making small steps, pushing their teeth straighter and straighter using the plastic aligners. But how do braces actually work? What's the force that's actually straightening teeth when we use braces? Well, we put brackets on the teeth. Okay, these are handles that we glue onto the teeth basically. And each one of those brackets is custom designed for that particular tooth and the position that it needs to be in at the end of the treatment. And with our system that Don McGann created called the individual patient system, we actually customize each bracket that we choose to take care of the specific problem that tooth has. If it starts out very rotated or it starts out blocked out to the lingual or the buccal, we choose different brackets depending on what movements need to happen to make sure that they happen correctly. So we put these handles on the teeth that have a prescription cut into the metal of the bracket that's going to help guide the tooth. And then we have these brackets that are on the teeth all crooked because we're putting each bracket into the ideal position for each tooth. So the center of the tooth from mesial to distal at the proper height that we've prescribed using a little tool to help you get the height correct. And then angled so that the bracket follows the long axis of each tooth. So the brackets are all over the place. And we take a very small diameter round wire. If we were to cut it in cross section and look at it, it's round. And it's a nickel titanium wire. It's a very, very light force. Like you can crumple this wire up in your hands. You can tie it into knots. And when you let go of it, it just springs back to its original shape. It doesn't have a lot of force. It's just a very gentle force that wants to spring back to its original shape. So when you go and tie this very flexible wire into these brackets that are all over the place, everywhere where the wire is deflected from its original shape, the wire slowly and gently wants to return to its original shape, which is putting a gentle force onto the teeth. And we have found that the body responds best to a constant, gentle force. So a force that never goes away, it's constant, and it's gentle, okay? Because it allows the blood supply to bring in the cellular activity necessary to remodel bone and gum tissue so that the teeth can move. And so that's all we do. We just tie in this wire. It's a very light, small wire. And basically, in about 6 months, you can straighten just about anybody's teeth in 6 months using this small wire. Now, there's a lot more work to do because from the time we get the crown straightened, we still have to get the roots aligned under the crowns. We have to coordinate the upper and lower arch. So if there's class 2 or class 3 to correct, or if we had to extract teeth, we have to close up extraction spaces. So there's more work to be done. But that initial alignment of the teeth that gets them straight is just coming from this very gentle force that's always there from this really flexible wire that we call an 012 or an 014 nickel titanium wire. After the teeth become straight, all of the crowns have become straight, all the rotations are gone, and they're leveled. We move into our second wire, which is now a rectangular wire. And so we call this an 18 by 25 wire. And it begins to engage into the bracket slot of our braces pad. So we have this pad on the tooth. All right. And now we have a wire that is engaging into this bracket. And now that the wire is engaging, because it's rectangular rather than round, it starts to express some torque or some twist onto the roots to get the roots to line up underneath the crowns. So we spend about 6 months with a wire that is heat activated, which means when we chill it or get it cold, we can distort it into all kinds of different configurations easily. It becomes very soft. And then when it warms up in the patient's mouth, it wants to return to its original shape. So any little twist or little bend in the wire will kind of bounce back to its original shape. So it starts to twist or torque the roots to get underneath the crowns. And then when we have the crowns aligned and leveled, and we have the roots aligned underneath the crowns, then we put in a real big, stiff, rectangular wire that we call a 19 by 25 stainless steel wire that more fully fills up that bracket slot to express the prescription that has been cut into each bracket. And now that we have a big, strong wire that can prevent unwanted movements, we can start to do things like close extraction spaces or shift the upper and lower teeth so that we can get into a class 1 occlusion. It's kind of like now we've laid down big railroad tracks, and now we can move the railroad cars as we start to coordinate the arches. So that's the stage at which you see patients wearing coils in their mouth or rubber bands or appliances to help shift their teeth into a class 1 position or close extraction spaces. So we call that our mechanics stage, where we slide the teeth along this stiff wire to get them to be in the right position for coordinating the upper and lower arches. And then once we've got that taken care of, we go into a smaller round stainless steel wire that we can put some little bends in just to do some finishing, just to fine tune, make sure all the teeth look like they're lined up properly and the aesthetics are correct, and let the bite start to settle. And after the finishing stage, we go into retention. We go into wearing retainers and monitoring their retention. So there's a lot to learn about the details of each one of these stages, but that, to get rid of the mystery, is the basic way that we straighten teeth. It's the 5 stages that we go through with every case to go from crooked teeth to straight teeth that have the roots aligned under them and where the arches coordinate. As we go through and teach and we learn about these different types of cases, we realize that understanding different patients and diagnosing them properly and selecting cases properly is a really important part of our success. So I've pulled up 3 lateral cephs here, which you can hopefully see demonstrate 3 very different adult patients. Okay. The one over here on the left is called a skeletal closed patient or a brachyfacial patient. Their jaw angles are very compressed and they're very parallel to each other. This patient has very strong muscles, very dense bone, and they tend to break a lot of their teeth. You can see all the restorations, the missing teeth. Okay, this is a very strong muscled patient whose muscles of mastication to close their mouth since they've been a little child have developed a very compressed lower third of their face. So this person's teeth are going to move very differently in their mouth than a person who has a skeletal open pattern, or we call it dolichofacial, with a high angle, a high gonial angle to their mandible, and with plane angles for their maxilla and mandible that are very divergent compared to these more parallel ones. So this is a very weak muscle patient whose teeth just tend to want to drift forward very easily. Their bone isn't very dense. It's easy to pull a tooth out on this patient. They don't tend to break teeth or wear their teeth down much at all. This is a very weak muscled patient who tends to even have dental open bite in the front, where these patients tend to have dental deep bite. And then in the middle of that, you have our what we call mesofacial patients who are average muscle strength and they're more average pattern to their face. And so these 3 types of patients, we have to learn to recognize and diagnose them properly, because the way that their teeth are going to move due to their muscles and due to their bone density is very different, and we treat them very differently. So just because we look in a mouth and see crowding doesn't mean that we're going to do the same thing for every patient. And we're also looking at facial profiles, because some of us get caught up in the trap. If you've ever done an aligner case and you just get focused in on this setup that gets sent back to you by the aligner company, And all you're looking at is to make sure that the teeth get straight in this setup. And you forget that there's actually a patient connected to this 3D digital setup that's just drifting around in space where we can move anything anywhere we want. And you go, no, there's actually bones. There are areas where we're going to hit resistance because there's a cortical plate there that's going to resist the movement that they're trying to apply over here in the setup. And there's lips involved. There's a face, there's soft tissue. If the patient's lips are already sticking out way too far, then we don't want to do any treatment that's going to push the teeth out any further and make them look worse. If their lips are already too far back and they're very concave in their profile, we don't want to do any treatment that's going to retract their teeth back and make their profile look worse. So when we treat cases, we're not just straightening teeth, we're actually trying to maintain or improve people's facial balance, their profile. And remember that we have bones and soft tissue attached to this patient who are going to be affected by the way that we move their teeth. And so, if somebody just walks up to me and shows me a model of teeth and says, how should you treat this? I go, I don't know how to treat that. I would have to see the way that this model relates to the patient's bone structure and their facial structure to know how we should treat that, because it's not going to be the same for every patient. They have different muscle strength, their teeth will want to move differently, and they have different conditions to begin with that I'm going to want to try to treat to make them look better, not just get their teeth straight. So there's a lot of education and learning that goes into this process. But, if you've dabbled in aligners, which is what I had done before I started progressive aligners, I realized that I don't know enough and I'm going to get myself in trouble. And it's not just about straightening the teeth, but it's about doing things that are predictable and that are going to actually be clinically achievable. And that's the appropriate thing to do for this patient so that they actually get a nice result. Okay, so just to show you a very quick example, you'll look at lots of cases when you come and do the seminars. Here's a case where there's crossbite, there's a lot of crowding, and you can see there's some ceramic brackets in the upper, there's metal brackets in the lower. But just like I mentioned earlier, the brackets go on, they're all crooked because the teeth are all over the place, and you tie in this very gentle wire that is deflected in all these different directions, and it just slowly wants to return to its original shape. And at this stage, you basically are just seeing the patient every 8 to 10 weeks to just tighten up any little spot where maybe the wire was tied in and that tie has become a little bit loose. There's actually not much to do. And the case slowly starts to get straight. And they come back and see you every 8 to 10 weeks, and you just basically watch the teeth get straight. There's not a lot of work to be done here unless a bracket pops off or something's poking the patient. And, orthodontics is actually not that complex. It's the choosing the correct cases, doing the initial diagnosis properly, which is why you take the education. Obviously you're going to have to learn how to put brackets on and how to tie a wire in, but that's not difficult to do. But it's learning how to choose the right case and diagnose it properly, which, we have mentors and consultants to help you until you feel confident. I used a mentor consultant for the first several years on all my cases until I was like, hey, I've seen enough of these now. I feel confident that I know what to do here. And I'm not wondering if I'm doing the wrong thing and I'm going to hurt this patient. And as you continue on through those different 5 stages that I mentioned, the teeth get straighter, we coordinate the arches and get to the point where we're finishing up the case. So teeth get straight in about 6 months. We spend another 6 months trying to get the roots to be aligned underneath the crowns. Then we spend another probably, 4 to 6 months, depending on what needs to happen to coordinate the arches, get it to class 1, get extraction spaces closed, whatever's needed. And then we're going to spend 3 or 4 months in finishing, putting little bends in the wires until we get the teeth nice and straight. And so that's why most cases take us somewhere between 12 and 24 months to, easy cases go a little bit faster and more complex cases take longer. And, we're going to teach you how to do orthodontics at the level of the specialist so that you can confidently go in and know that you have mentors and consultants to back you up, to help you until you feel confident on your own to be able to go and do high level ortho. Okay, not just straightening people's teeth, because that can be done with a lot of different systems out there. The 6-month smile system, it can be done with, aligners delivered directly to the patient. Lots of different ways just to kind of get crowns straight, but to actually do good high level ortho, we need to have a good education. Here's an interesting tooth that, you see this all the time, this real high canine here. What had to happen to go from this to this? Nothing, just time. There was nothing done here, okay? Just simply the fact that you have this little white light wire tied in and it's displaced all the way up here to this canine that's high. When the patient comes back, you could have this patient disappear for, 3 months. And when they come back, you're like, wow, look at that. We're almost completely fixed here and I haven't done anything. I just put these brackets on and tied this wire in and it's getting straight and everything's, this tooth that's in crossbite is getting out of crossbite and everything's happening just because these teeth are getting straight. So it seems very mysterious if you haven't done ortho, but once you start to get a little bit of a dental or an orthodontic education and get the mystery removed and realize that, hey, teeth move when there's this little wire that wants to push them in different directions, it gets rid of the mystery. And all of a sudden you're like, hey, that's not that difficult. If all I have to do is choose the right case, make the right diagnosis, and put the brackets on straight, or at least put them on in the ideal position for each tooth and tie the wire in and just sit back and watch them get straight. When I talk to my patients about straightening their teeth, I try to focus on the fact that straightening the teeth is more than just aesthetics. It's not just so that you have a pretty smile, right? And so I didn't talk to many of my adult patients about doing ortho unless they were just an absolute train wreck, because in my mind, it was just more of an aesthetic thing. And if they weren't talking about aesthetics or bringing it up, I'm like, well, they're fine, right? But that's actually not true. When I align a patient's teeth, whether it's a young patient or an adult mature patient, or even an older patient, if their teeth are not aligned properly, they don't function properly. And when they don't function properly, things wear out irregularly, right? We all get that when we go to get new wheels, that if the wheels are out of alignment, the tires that we just bought are going to wear unevenly because our wheels are out of alignment. So it makes sense that if our teeth are out of alignment and we drive them down the road, we use them, that they're going to wear irregularly, So poorly aligned teeth lead to very irregular wear patterns on the teeth, and they can lead to abfraction, severely worn incisors at, very strange angles. It can lead to broken teeth, broken restorations, chipped porcelain, all kinds of problems that the patient then has to pay for. And they actually would have been better off to just pay to have their teeth aligned properly so that everything would wear. It'll still wear just like a tire, but it wears evenly and it wears appropriately. So you don't get this uneven, inappropriate wear patterns on the teeth. But even beyond the wear of the teeth, when we talk about function, if we can get the teeth in the right position, now the patient learns how to even function properly when it comes to how to use their tongue, how to use their lips, how to swallow properly, okay, how to breathe properly. And so, I work with a myofunctional therapist. I work with an ENT. I work with doctors who can help me to train the patient to use their muscles properly. I work with a doctor who can help me establish an open nasal airway so that they can breathe properly. Because if I have a patient who can't close their lips, can't breathe through their nose, it's going to be very difficult for them to function properly. So beyond just how the teeth wear, it's how this patient's whole head and neck functions around their teeth. Okay, so helping them learn that, hey, to have straight teeth, you also have to use your tongue properly and use your lips properly and breathe properly. And that goes a lot further than just a pretty smile. This actually has a lot to do with the overall health of our patient. In fact, there's a fascinating book out there called Breathe that I recommend. And when you look at even just the difference in health between breathing through your nose and through your mouth, it's pretty fascinating. And so, patients who can't breathe through their nose cannot really get their teeth straight either. We have functional problems like tongue thrusting, lip, thumb sucking habits that lead to dental open bites. And so in order to fix and get proper function, we need to get the teeth in the proper position. The teeth are where the muscles are telling them to go. So again, it's not just pretty smiles, whether we're doing phase 1 ortho, which you learn in our full courses, you learn how to do that early interceptive orthodontic work, how to guide their growth and development so that they end up developing properly. You not only give them a pretty smile, but you help them to function properly, to chew, swallow properly, breathe properly. Their TMJ is going to last longer. Everything is going to function better. Here's an example of a crossbite, which is not, it looks like a unilateral crossbite, but truly this is a bilateral crossbite. But this patient, here's their lower dental midline, and here's their upper. This patient is shifting their jaw over to their right side in order to basically fit their teeth together. And so that's why we have a crossbite on one side and no crossbite on the other side. It's because the patient is shifting their jaw over. And so if we catch these things early and teach you what's needed to be able to go in there and correct the problem. So let's say we put in a rapid palatal expander. So now when the patient bites, they're biting on just a flat plane splint, essentially, while we expand the upper arch to be wide enough to receive the width of the lower arch. And at the same time, put some brackets on to help straighten the teeth and get the teeth out of crossbite. In 6 to 12 months of a phase 1 ortho treatment plan, you can end up where you've made a drastic difference to this patient. So instead of having your upper midline here and your lower midline over here, not because the teeth are shifted, but because the whole entire mandible is shifting over to one side, giving them facial asymmetry. They kind of talk out of the side of their mouth. Now we've made the upper arch wide enough so that the patient can now bite down without having to shift the jaw. And you can see that the lower midline is now, it's not perfect under that upper one, but it's a heck of a lot closer than it was at the beginning. And so now as this patient grows and develops, they're going to develop more symmetrically. They're not going to be putting pressure or irregular wear on their temporomandibular joint. Their teeth are going to wear more evenly. The bite is not as deep. So being able to recognize, to know what you're looking for, to know what to do to help these patients grow properly, it's more than just pretty smiles. It's more than just aesthetic teeth. It's about creating health in the gums and bone, health in the joint, health in the way the muscles function and the way they breathe and swallow. Translate that to an adult. Here you've got an adult with, again, some crossbite problems, and look at the shift of this mandible. So here's the upper midline right here. And this lower midline is shifted way over here. So this patient is shifting the mandible off to his left side. And you can see the crossbite over on that side, right? And so on an adult patient who's no longer growing, you can't just put a rapid palatal expander in there and make their upper arch bigger. So we'll probably have to do some extractions in order to close the spaces in a way that allow us to get the bite settled properly. But look at the end result. Those midlines are lined up and the patient is no longer shifting. So not only does he go from having, kind of a smile that's not attractive to one that looks really nice, that's a great service. But look at what you've done to create healthy function, kind of like aligning those wheels before you put the new tires on. So that's what's cool about orthodontics is, yes, you're making money, you're having fun in your practice, you're becoming a better doctor, but you're also helping patients to not only have healthier looking smiles, but actually healthier functioning mouths. Let's talk about periodontal health, okay? You and I all know that when the roots, we would never put an implant too close to the root of another tooth because we know that there has to be a certain amount of bone or space between the root of one tooth and an implant, or between one implant and another implant. If we don't have proper spacing between the roots or between the roots and the implants, then there's not enough bone supply, and we basically choke out the health of that area and we cause disease. And so if a patient has roots that are overlapping and teeth that are overlapping, they end up getting periodontal disease in those areas. Where if we go and make them straight, not only does it look prettier, but it actually functions much better and is much healthier for that patient. So here's an example of a very crowded lower dentition. And if you came to me and said, I'm not giving you all the records here, and said, hey, how do you treat this case? Or would you go and extract some teeth or not extract teeth? I would say, I don't know. I don't have enough information here. So I'm not giving you the full story. What is the starting angulation of those lower incisors? Are they tipped too far forward? Are they tipped too far back? Are the patient's lips already sticking out too far? Are they too far back? Is the gum tissue healthy enough to say that I could advance those teeth? There's a lot of questions determining whether or not we should extract some teeth in this case. So we're not going to go into those details right now, but what I want to focus on is look at the overlap of these teeth. And if we look at the panoramic x-ray, which I kind of look at as that fence picture we just looked at, we can see that these roots literally are on top of each other. They're overlapping each other. Okay. And we know that long term, that is not going to be healthy. I can already see the calculus build up in here. I can already see that there's a more purple color to the gum right here. This is going to, even though this is a younger patient, this is going to lead to probably tooth loss in this area, or at least some advanced periodontal disease, okay, if left untreated. But we just do what we know how to do. We go in there and we make the proper decision, which for this patient was to not extract teeth, okay, because her lower incisors were tipped too far back and her profile would look better if we brought them forward. And so we do not extract teeth on this patient. We just go and we place the brackets on the teeth. We tie in that arch wire and we allow that little small wire with that light nickel titanium force to just slowly start to straighten the teeth. And before you know it, only about 5-6 months into treatment, you're not done, but you already have basically straight teeth with better spacing in between those roots. And what does that do to the health of the tissue? We go from something that you can tell is not going to be a healthy situation to something that already is looking much healthier. And even this tooth, this lower right one that is pushed a little bit too far to the buccal and the tissue looks a little bit thin there, when you start to align all the teeth properly, even that tissue starts to thicken up around that tooth and starts to look like it's healthier. So now you have something that not only looks pretty, okay, but is going to actually function better because you're not going to get irregular wear patterns and you're not going to break something off because of the way it's hitting. And you have healthier gums that are going to have healthier bone because you've created the right alignment and space between the teeth. So to be able to bring something into your practice that's fun for you, that makes you know more and be a better doctor because you're looking through a new set of lenses, that makes it fun for your staff and your team because people come in excited, increases the revenue, increases the profit, and you do a huge service for your patients, not just to make them look great, but to actually improve their health. Why would we not want to do this as general dentists in our practice? So looking at this panoramic x-ray before and not after, because this is not a completed case, but at least looking at the point at which we were like, hey, do we need to reposition any brackets in order to align the roots? Well, yeah, this root still needs some better alignment that way. So we'll reposition this bracket. I'd like this root to go that way. So we'll reposition this bracket. But look at how these lower incisors are all starting to straighten up and we're getting the correct amount of space in between those roots. So we're going from this to this. And there's no other way to create this type of health in a patient without doing the ortho. So to keep this under an hour, as I promised, you can tell I love talking about this. I would love to talk more about these cases. And when you come in and start taking these seminars, you're going to sit down and go through cases and you're going to learn what this is all about and how to do it. And you're going to love it. I invite you to come learn with us. It's fun. This is an amazing company to learn with. The hands-on exercises, the instructors that we have, the friendships that you make while you're here, the free software that we have that you're able to learn how to use in order to work up and treat your cases. Or Progressive Orthodontic Seminars really is the world's #1 orthodontic education and mentoring system for the general dentist. And everything that we've just talked about, elevating your practice, having a high level of support so you can talk confidently to your patients that you do ortho. Earning while you learn. We have free lifetime retake policies, so if you take the seminar and then you want to go retake the seminar, you can show up anywhere the seminar is offered for free and retake the seminar, or use all of our online material that's available to retake virtually the seminars. We have traditional ortho classes and aligner classes, and I encourage you to learn both. I want to use both of those tools so I can treat a wide variety of cases in my practice. The difference with Progressive Orthodontic Seminars, one, I want to learn from another general dentist who knows how to do high-level ortho, who knows how to do orthodontics at the level of the specialty. Because the general dentist is on my level, speaks to me as a colleague, isn't just teaching me how to refer. And so a general dentist teaching another general dentist how to do high-level ortho, for me, was a great fit. It really felt comfortable. I wasn't intimidated, okay? So you have very skilled general dentists who are teaching you how to do high-level ortho. And our commitment is to teaching a comprehensive approach. It's a full orthodontic education to help you know how to do ortho at the level of the specialty, so you don't get yourself in trouble. None of us want to get burned and get in trouble and have a patient upset because things didn't come out right. But we want to teach you something that, since you don't do a ton of ortho in your practice, something that's easily reproducible, that's predictable, that's going to work in your hands in your practice. And then have the level of support that's going to help you be successful and help you, grow in your confidence as you work through cases. We're dedicated to developing, improving, and perfecting the science behind the methods that we teach. And we teach a systematic approach to make it easy for you to learn and to understand and to apply to a wide variety of cases and be successful. We have some different formats that we teach in. We have in person, where you come to we don't have as much of this as we had before COVID, but this has always been the most popular way to learn. For me, it's the best way to learn because it makes me set aside all the distractions. I know I have a family, I have a busy life. So if I just take the time on a weekend to go and leave my practice for a day, spend my weekend there with other people who are learning, and all of my distractions are removed, and I can commit that time to really digesting a lot of information, that works well for me. Other people really like a hybrid version where they do some stuff on their own, but they come in at certain points along the way and meet in person. So there's fewer in-person meetings, but they're doing a combination of self-study and in person. We have virtual classrooms, so some people will go and actually attend these seminars live, only they're not in person. They're doing it through Zoom, through a virtual classroom. And we have some doctors who choose to do it fully self-paced, where we give them access to all of the videos that have been recorded, to all of the PowerPoint presentations, to all of the explanations, and they go through at their own pace with the help of an instructor, mentor to support them as needed. And so there's different ways for you to learn that might fit your life. And we can describe that to you more. There's a lot of details here that I have eaten up a lot of our time and don't want to go into all the details. But we have Iveta on this call, we have Morgan on this call, and at the end, I'm going to give you their contact info. And they will go through each one of these different formats with you and help you find a format that's going to work for you. If you're going to come in person, to find a location that's going to work for you, to find some dates that will work for you. We have a lot of new in-person, full traditional ortho series that are starting right now within the next couple of weeks to months. And so this is a great time to just say, yeah, I really want to do ortho. I really want to learn more about this, and I want to do this in my practice. So they can help to walk you through these different dates and locations and times and find a format that's going to work best for you. Okay, so there's a lot to discuss about each of these different formats, the strengths and weaknesses and different options. There will obviously be some educational kits available for you to learn hands-on so that you've done this type it on a skull before you go and actually do it on a patient. We have a lot of resources for you once you've signed up for courses. We have, like I said, this worldwide lifetime free retake policy. We have some doctors that will pop in wherever we're offering a seminar, Vienna, Amsterdam, Singapore, because they want to go travel and they know that they can come and retake that seminar for free, but they also get to, make that a CE trip. And so, we have doctors that go and retake these classes all over the world and travel different places. When you sign up for a seminar, you get a free mentoring case. So you actually get a mentor to help you with your initial case. And then for a fee, usually it's around $300 to $400 per case, you can continue to have a mentor consultant. That's all explained in the classes. We have awesome software called SmileStream that is there to help you learn and to help you work up, diagnose, and treat your cases that you'll learn in these courses. Lifetime support, on-demand streaming seminars and videos, and a combination of different ways to learn the material. There's even training available for your assistants. For me, I want to learn ortho, but I also want to learn how to do as little of what I need to do. So I have a very skilled assistant who can do everything that he or she is able to do, so that I can be in the other room cutting a crown prep or doing a veneer or placing an implant. And I only have to come in and interact with the ortho patients as needed by a doctor. And if I have a highly skilled assistant or team, we can do a lot of ortho between brackets and aligners in our practice without me always being there to do all of the work. We have a mini series that's just focused only on aligners, which some doctors who are just getting started decide to just maybe start with aligners before they take the traditional series. I love the traditional series. I highly recommend it. Okay, and then same thing, we have different formats for the aligner series. We have in person, we have webinars included with self-study. We have hybrid formats where some is done self and some is done live. We have self-study with a mentor. Okay, so Morgan or Iveta can go over all of these different options with you: locations, prices, promotions, discounts for different situations. For the traditional ortho series, when we come live, we generally pay $1,500 per seminar. We can get a prepaid discount that's pretty significant if we want to pay for them all up front, or we can just pay for them as we go, so that we're earning and learning as we go and basically paying for it as we go. Okay, there's discounts for doctors who have already learned some ortho. You can skip over even a couple of seminars. There's discounts available for new dental students and new grads, military discounts. And for you guys who are here today, if you reach out to Iveta or Morgan or any of our sales team and let them know that you attended this evening, this 1 hour intro, and sign up, you get $500 off the first seminar. So it would only cost you $1,000 to go to the first seminar. If you bring a friend with you, you'll get another $150 off, plus they'll get a discount as well. So I want to thank you for spending your time. I'm happy to sit on for a few more minutes and maybe answer some questions that you have. But those of you who I promised we would do this at or under an hour, I want to thank you for coming and hope that you felt my excitement, and my desire for you to incorporate this into your practice, because I've loved it. It's been a huge part of my life. It's been something that's made a big difference in my general practice for both me and my team and all of the patients that we treat, which include my own kids. I got to treat my own kids as well. So here's Iveta's contact info. And here is Morgan's contact info. They're both on the call right now. I might even give them a minute to say hi, but please take that information down. Let them know that you attended tonight or that you watched this video so that you can get some promotional discounts to get you signed up. So thank you. I'm totally happy to take questions. Why don't I let Iveta and or Morgan just introduce themselves and say hi real quick. And then if you have a question, go ahead and type it into the chat.
Hi, doctors. My name is Iveta. I work at Progressive Orthodontics Seminars. Anyone has any questions, please, you see our information. I have my colleague Morgan attending as well, and some of you have been already in touch with him. But I want to thank Dr. Harrell for the very informative and wonderful class. And I'm glad to see some of the doctors also from Myanmar and some Australian members joining. Yes, we have several locations that we are starting, including Chicago, New York, Orange County, Florida, and the different formats, self-study with a mentor, virtual classes. So please, for anyone who has any further questions, please reach out. If you would like to attend or get more information on the traditional ortho or aligners, we are here.
Thanks, Iveta. Morgan, you want to say hi?
I would love to. Iveta, that was great. Thank you, everyone who showed up. Obviously, Dr. Harrell, well done as always. It's a pleasure to obviously see all the doctors from around the world. Thank you for showing up. And I'll probably reach out to those of you. Check your emails, and we'll be in contact tomorrow morning. Thanks again.
Awesome. Thanks, Morgan. And thank you, the rest of our administrative support team in different parts of the world that are here with us. We appreciate you guys being here as well. So doctors, if any of you have a question you'd like to ask, I'm happy to take a question. That's probably the fastest I've ever gone through and taught things where there's a lot to talk about. And so I know I said lots of things and skipped over probably lots of opportunities to go into more detail, but we wanted to keep this to an hour for you. So if anybody does have something you'd like to ask, feel free to just unmute yourself and you can ask or type that into the chat. All right. I was so good. You know everything you need to know at this point. So awesome. Well, as I said, I'm very happy that I was able to spend a little bit of time with you. Hopefully you enjoyed this. Please reach out. If you do have some clinical questions or something that you want to ask, Yvette Morgan can direct you to me as well. So thank you for joining us. We'll let you go. Have a great evening or a great day wherever you're located. And hopefully we'll meet soon in person at one of our seminars. Okay, thanks everybody.